Hello, it's Dr. Gay from First Look MRI, and this is a 17-year-old male who injured his thumb recently. He had pain over the first metacarpal head area here, and the surgeon was worried about a tear of his radial collateral ligament, so did an MRI of the thumb. And here on this view, we can see the thumb. This is the joint we're concerned with, and around the ulnar side, we have the ulnar collateral ligament, the UCL, the one we're usually worried about, but it is not ruptured. I can see this dark band going here from the metacarpal head to the proximal phalanx. And in this case, the surgeon was more worried about the radial collateral ligament, which is on the opposite side. And this is the radial collateral ligament here, this little dark line. So this is not ruptured. So we did answer their question. No radial collateral ligament tear. But the patient does have marrow-edema, lots of marrow-edema here in the metacarpal bone, the first metacarpal bone, the junction between the head and neck here, even going into the shaft. So we're going to look at that a little more carefully. Some fogginess over here as well on the dorsal aspect of that. So these are some larger field of view images of the hand, and we happen to see something in the wrist down here. This is the hamate bone. There's abnormal signal here. There's a stretch fracture or non-displaced fracture. It's not healed here. The hamate bone is bright and patchy. Also the bone next to it here, the pisiform bone, we can see has abnormal signal. Here's the hamate bone. This is the hook of the hamate bone, and that patchy brightness means that there's a bone contusion or stress injury. Is the pisiform bone also has marrow edema, no displaced fracture. So incidentally, we found these other images, injuries in the wrist. But now we're going to go out to where he's having symptoms. This is the first metacarpal bone. We're getting towards the head, and we see this black cortex going around here. But right over here it looks a little funny. And in this view, it looks like there's a defect right within that bony cortex. And this is really prominent marrow edema. And now we're getting to the joint. So this is the joint. This is the ulnar collateral ligament, radial collateral ligament. Here's the flexor pollicis tendon here, and we see the radial collateral ligament is here. It comes up and attaches to the bone here. So this injury is right adjacent to it. It doesn't look like it really involves the radial collateral ligament, but may touch the edge. And again, we see this defect in the cortex, soft tissue thickening around this. So this is right where it's hurting there along the radial aspect. And it just doesn't quite involve the radial collateral ligament, just dorsal to that. So the joint capsule attaches out here. We're going to put up a different orientation over here to see, whoops, that. And on this view we can see what is going on. This is that marrow edema. We see this joint capsule coming over here to attach. I'll put up a different view that'll show this slightly better. And here it is. This is that dorsal joint capsule coming across. And it's going to attach to the metacarpal bone here. Here's the head and neck. And you can see the joint capsule. And instead of sitting down lower, it's elevated, it's pulled up, and so this is a scalloped area. This is a cortical defect. So there's a little cortical or periosteal avulsion injury here. It's uplifted, and the joint capsule remains attached to it. Some edema in the underlying soft tissue, so this patient is just a little cortical or periosteal chip fracture that's pulled off. The joint capsule is attached to it. It probably blends right in here, and sometimes these can be really hard to see, the little avulsion fracture fragments, but you can see the secondary findings of this is elevated off. We see the bony defect. We see the marrow edema that's really prominent, so you know there's a sniffy injury there, even though it doesn't show up that great here. On an x-ray, it's really easy to see the little cortical chip fractures uplifted, so if they did an oblique orientation, they'll be able to see that little thing uplifted. But again, this is a tear of the the dorsal joint capsule along the radial aspect. The joint capsule attachment is injured. It's pulled up with a little cortical avulsion fracture fragment and marrow edema, and it looks like that radial collateral ligament is not ruptured. One more just incidental or interesting finding here. There's a barely discernible area of brightness here. This is the adductor pollicis muscle. There's two components. There's the transverse and the oblique components. This is just the transverse component of the adductor pollicis muscle. Has a mild strain. We can see it right here. This foggy brightness right along here. The other muscles are nice and low in signal, so just a very mild injury of that. And that's it. So just a avulsion fracture from the first metacarpal bone at the dorsal radial joint capsule attachment, but thankfully no radial collateral ligament rupture. Thank you very much.